Hey everyone, and welcome back to the Fortitude Fix. I hope you're well. My name is DaShanna, and in today's video I am going to be talking you through my 34-week ultrasound appointment that I had today. I want to sit down while it's still fresh on my brain, while Nova's asleep and my husband is taking a shower. He just got done working out. So while I have a little bit of quiet, I wanted to film this for you. So you will be seeing or hearing a little bit of information about this ultrasound in my 8-month pregnancy update, but I wanted to just go ahead and make a separate video about kind of the happenings of the ultrasound itself. So by now, if you've been watching my channel, you will know that we moved. So we bought a house, and so that's why my setting looks a little different. Still trying to figure out the lighting and the best places to film, but yeah, let's just go ahead and get into the video. I had my 34-week ultrasound scheduled for, I think, earlier this week, but we moved it just a tad because of the move. So I am no longer going to the office for the ultrasound that I was going to before. I am now quite a ways out. So we had to kind of move things around and find another location for these ultrasounds. This appointment was at a new medical center, which was fine. I gave myself enough time to kind of get there, hopefully, and be there on time. But I was there right on time, but I wasn't early, which, y'all, the parking situation was a mess. A couple of things to note about this ultrasound. It was simply just the other ultrasounds that I get during my pregnancy to keep an eye on my fibroids as well as my sickle cell, check baby, make sure everything's going well. There were no pictures this time, so I didn't get any printed pictures of baby, but I did get to see baby, so it was a lot of fun. Also, there were no vitals for me, which is new. Typically, they always take my blood pressure, temperature, weight, but they did not do that this time, so something to note. Okay, so I had a really awesome ultrasound sonographer. Her name was Jasmine. I am like, hey girl, hey. She was like super warm and welcoming from the moment I walked through the door, and I really just loved her bedside manner. She was always checking on me, making sure my positioning was okay, and you know, she was like, be sure to scream at me if, you know, I'm pressing a little too hard, etc. I was totally fine the whole time, but I really enjoyed her and her demeanor. So she was looking at baby's like diaphragm and her lungs and her stomach, and then came upon baby's bladder, and it was so interesting. I had like a well, it's the health educator in me, but just like the thought of like, I'm like at some point, behold, like I'm looking at my grandchildren in a way, if you think about it, because as you know, babies that are born with ovaries and eggs, they have all of the eggs that they will ever have. We don't create more eggs. And so when I'm looking at this like baby inside me, but looking at their reproductive organs, it's just like, it's mind-blowing, right? Because like the eggs are there somewhere. Like those are like my grandchildren. Oh my god, I can't. It's crazy. So sci-fi. I had this moment and it was really interesting, but everything looked good. Some things were measuring right on par for where I'm at currently at 34 weeks pregnant, and some things were measuring well far ahead at like 38 weeks, which was hilarious. But it was really cool to get in there. I saw baby's hand and like baby's fingers and feet, and I could feel her and her face and her lips, and it's just so cute. So I'm really excited. It was a really good appointment. Something I do want to mention, I asked, because she was looking at like the anatomy of the baby, and I asked like, are we gonna go ahead and like look at the fibroid? And she was like, oh no, not this appointment. And I was like, oh, okay, so interesting. And I gave her a little bit of a background as to why like I even have these like ultrasounds. But I didn't know that you have regular ultrasounds when you're pregnant, but I have more on top of that. So I was saying how we check and look at them all the time because I have two large fibroids up in the top left on the outside of the uterus, and they just wanted to check and just keep an eye on the size and that it's not impeding on baby's space. as well as keeping track of like my sickle cell and everything for these ultrasounds. So she wasn't gonna do it at first, but then she ended up doing it because I asked. And so she was thinking like, oh yeah, maybe the doctor wants to see that and see the difference. She's like, I was able to see them on your last ultrasound, etc., etc. So great. That's another like tip and point for you all. Like, no matter if you're going to a new doctor or the same doctor, but like if you feel like something should be happening, or if you feel like you want something to happen, definitely go ahead and ask and advocate and say, this is important to me because X, and I think it's important that we take a look at this because of Y, you know what I mean? So we got to take a look at the fibroids, and she measured them together, she measured them separately. We can't really see a defined, like it's kind of hard to tell, but we do believe it's two that are like right up against one another. She was mentioning that like baby seems to favor the right side, and I said, yeah, it's been that way for like the last couple of months. Do you think that it has to do with the fact that the fibroid's on the left side, that baby is on the right? And she said, honestly, it's really hard to say, but she did say the fibroids are pretty like malleable. Like if baby wanted to move over here, the fibroids would just kind of, you know, go around, you know, this, you know, and you know, create the room. So it could just be that baby favors and prefers this side, which I think is the case because this is where baby's been for months. And so originally baby was head up, baby was breech, so her head was up here, feet were literally just straight down, and I saw that in my last ultrasound, and I could also feel it. Like Nova felt like she was in my rib cage. This baby feels like she wants to walk out, right? Like I felt like feet at the very bottom. So now a baby is no longer breech, baby is head down. So I am starting to feel all the limbs and everything up here in the rib cage. So super good to know that baby has moved. I can tell this baby is a mover. So baby is no longer breech, which is awesome. Fibroids are not causing an issue. Another thing that this sonographer said to me that I want to pass on to you is that in her experience with people with fibroids, she said honestly it's like a fight for them to get them removed. So I have always been told if they're not causing a problem, it's better to leave them alone, like just leave them where they're at. Obviously when you're pregnant, the hormones and the extra blood that you have is going to kind of like feed or nourish the fibroids for them to get bigger at some point or another, you know, because your uterus is growing as well. However, generally speaking, I have never had any other issues with these fibroids at all. So I didn't even know I had them until I was pregnant the first time. So she was saying people who have issues with their fibroids, they have to like fight to get them removed. So in my case, it's much more high risk to do anything with them because A, they're not causing any issue, never have. My periods were always regular, never had super crazy periods that were like painful, you know, very just chill and regular, even throughout my, you know, both my pregnancies. Also, because of my sickle cell, it would be an added risk to go in and do any sort of like myomectomy or removal of the fibroids because of the risk of infection to myself with sickle cell who has a blood disorder. So it's like stay put. But for people who do have issues, it's still sometimes a fight. So I want you to know that if your fibroids are causing you issues, if it's something that is really like hindering you in your life and your health, definitely advocate for yourself and learn what the possibilities are for you, whether it's removal or something else. But that was something that was really interesting. I thought that if they were causing issues, doctors would remove them, but it seems like sometimes it's a fight for patients to actually get them removed, even when they are impeding on their life. So just wanted to pass that along. So after the ultrasound was done, the sonographer ended everything, kept me kind of in position just in case doctor wanted to come in and take a look. Doctor did come in, but they didn't actually go through and use the machine at all. They just kind of chatted with me about the findings. So basically the doctor welcomed me to the area since I'm new here in the area, and she was like, we're, you know, happy to have you, great choice. And very super sweet. I liked her, like 180,000 degree difference from the other doctor that I talked about in my 7-month pregnancy update. complete like 180, right? So welcomed me to the area, super nice. Also asked me about having a prenatal appointment, and I said I do. I have one set up. So my next prenatal appointment is next week. And you know, she was like, okay, good. She didn't explain kind of why that was important to her or why she asked that question, but I think she just wanted to make sure that like we kept all of the existing appointments from where I used to live to now, so that nothing like fell through the cracks. So I am gonna be meeting with my, I guess, new OB at this like last or second to last prenatal appointment next week. She did say like, hey, your fibroids are big. And she said it in a very nice way. I mean, I know they are. And I said, are they bigger than they were before? I asked her, and she mentioned, you know, I said before they were around like 8, one was 8, I think one was 9 centimeters in the last ultrasound I had. So she said, you know, they're both measuring at 9, and so they, you know, she was like, yeah, these are substantial. It's like, okay, but they're not causing any issue with the space or with my pregnancy, so that's good. She did say here, and then in the last, you know, couple of weeks of pregnancy, just make sure, especially with the sickle cell, that I stay hydrated, and the fact that I'm in a different climate now. Like I mean, I'm not super far away from where I used to live, but I will say that the weather is very different here. And that's something that I've noticed as well. You know, my lips are drier, Nova's lips are drier, I need lotion all the time. It's just a different place and we need to get used to it. So she was saying, especially out here in the summer, like make sure that you are drinking water. So remember to stay hydrated, y'all. She did ask me if I had any issues with my sickle cell during this pregnancy, and I said no. So she's very happy to hear that. And here's the absolute kicker, y'all. She told me how much this baby weighs already. So mind you, I am 34 weeks and 4 days. If this matters to you, I went to 39 and 5 with Nova. So I was only 2 days away from my due date, and I started having contractions. That's when Nova was born. I'm assuming I'm gonna go close to my due date, meaning I still have about 6 weeks left of this pregnancy. So the doctor told me, she's like, yeah, fibroids are big. She said, and baby's big. and I said, oh, and she was like, yeah, baby's 7 pounds at this point, and you know, that's a little bit bigger than we usually see around this time. And she was like kind of like being nice about it, but I was like, what? So Nova was born at 8 pounds exactly. So for this baby to be 7 pounds already, and we're still 6 weeks away, like, got me a little nervous. But it does explain all of the things that I'm feeling. I feel large and in charge. I feel heavier. This is the highest weight that I've ever been in life, and my body is just treating this second pregnancy just slightly differently. But all in all, I'm blessed. Everything is good, and we are both very, very healthy. So I just wanted to share that with you. My husband stayed home with baby girl, and I did go solo. I wasn't able to get any footage or anything because they're not allowing like cameras and stuff. It's, I don't know, whatever. But yeah. Yep. Here is baby, y'all. So I'll give you a little bit of a bump date. Y'all see that? Just, whew. Oh yeah. Anyways, thank you all so much for watching. I hope you really enjoyed this video. If you did, go ahead and give it a thumbs up and subscribe to my channel for more of everything that's going on in my life here on the Fortitude Fix. I would really appreciate it. And I will see you very soon in my next video. And remember to always, always fill your cup. Bye.